I'm almost at a loss for words about what's happening in the state of Florida with Ron DeSantis, who refused to cancel spring break, who refused to get people off of sandbars where 100 boats would crowd around and people would have drinking parties all weekend next to each other, who is still refusing to close restaurants, who is still refusing to do what every healthcare expert in the world is begging leaders like him to do. And he's not doing it in a state that has millions of senior citizens, and they are dying. They are beginning to die. And yet he's still not moving, Jim. And I must say, I don't get it.
Yeah, I mean, I think the deniers are going to have to live with the stain of this for a lifetime. There's no way. Like, now you look delusional, right? You look delusional if you're not listening to what is now a national consensus. It took Donald Trump a long time to get there, way too long, as you guys have talked about on the show, for months. But now we're there. There's a national consensus. The scientists, Democrats, Republicans, doctors, anybody who's looked at the data, who's looked at the science, now agrees that there's a real chance that 100 to 250,000 people die. If we don't take quick action, it could be higher than that. That the effect is going to mean that there's going to be quarantine for almost everybody, probably not just April, definitely May, potentially into June. That you needed that economic package just to be able to keep the economy afloat for the next 2 months. That you're probably going to need another $2, $3, $4 trillion just in stimulus to be able to get the economy back up and running. So anybody who's out there, whether you're on Fox or whether you're a governor and you're still saying, well, I don't know, do we really have to take swift action? It's nonsensical. Just look at China, look at Italy, look at Spain, look at New York, look at Seattle, look at New Orleans, look at Detroit. This isn't rocket science. This isn't actually a political debate. The consensus is there. And so the big question is, and even I read Dr. Emanuel's piece, I think over the last weekend, like, he agrees that there's a way to get people, at least some people, back to work in June. But it's if you keep those deaths below 240,000, if people make smart decisions. So if people in Florida are partying or infecting elderly people who are at such high risk, like, shame on them. And I do think that that's going to require additional presidential pressure. There hasn't been a national directive mandate that everybody quarantine. And I think the next step is he's going to have to get out there and forcefully force people to do the things that they have to do, even if there's bad economic consequences in the short term.
Yeah. And Mika, Bill Gates wrote an op-ed where he said you have to make the shutdown national because Americans travel from state to state. You can't shut down one state and let people go to restaurants in other states because we still travel. We still go across state lines. Florida can't stop people from coming into its state. And other states can't stop Floridians from going to their state. So unless it's a national shutdown, Florida will continue with its policies, killing senior citizens and exporting death to senior citizens in other states unless Florida and every other state shuts down and begins to take this seriously.
And that's all responding to it. I mean, Zeke, this is here to stay. We're being held hostage to this until there's mass uniform testing or a vaccine. And yesterday we got a lot of information on how many people were going to die and the fact that we need ventilators. And we get a sense that the states are still in a situation where they're competing with practically everybody, even the federal government, for supplies to help respond to this. But what about being able to map forward? I mean, under what scenario would you advise the president to relax the physical distancing standards if there's no mass uniform testing, including antibody testing?
I think you're absolutely right, Mika, which is you can only begin to relax these standards once we see several things in the data. You have to see that the total number of new cases is plateaued, that the actual percentage of patients infected is going down. That requires the data and, as you point out, a kind of infrastructure for public health. You need testing, and we probably need more than 1 million a day in the United States, not 100,000 a day. You need contact tracing. So if someone tests positive, you can actually contact their people, connections to the tech companies that know how people move, who they interact with, so that we can do it rapidly. And you do need this big important change in behavior that has become habitual. I go out, I put a mask on. I come in, I wash my hands. I wash my hands 20, 30 times a day, and I don't spew out droplets outside. Those are big changes for Americans. And if we don't see that rapidly, and we're only going to be able to see that rapidly if we have leadership from the president, leadership from all the other elected officials and celebrities and everyone else. Behavior change is really hard. We know that. And yet we have to do it rapidly if we're going to get a hold of this. But I think you're also right. No magic cures. We've got to be done with that stuff, that it's going to be chloroquine. It might be chloroquine, but we need the trials and we need the data. The important element here is no opening up without solid evidence that we've actually turned the corner and gotten it down to zero and can have the infrastructure to squash it wherever it pops up.
Well, I did think it was interesting yesterday. The president's been spouting chloroquine as a miracle drug.
He pulled back
a little. He has no idea whether it is or not. Nobody knows whether it is or not because the studies have to be done. Dr. Fauci, Dr. Birx, and serious doctors understand that they're not going to give false hope because it's very dangerous. But, Willie, Jake Sherman had a list yesterday of all the things we were told early on that ended up being wrong about this pandemic. And I guess a lot of that's natural if it's not done in bad faith by the federal government and the leader of the federal government, the executive branch at least. But one thing that's up in the air right now has to do with masks, has to do with whether this is transmitted via aerosol. And many people are starting to believe that it is. It doesn't mean I read this morning, it doesn't mean that if you jog past somebody, you're going to get it. Or if you're walking past somebody 5 feet away, you're going to get it. It means if you're in the room with somebody, share the same air. If you talk to them for a while, then yes, people are starting to believe it's not just the droplets. As Zeke said, it's also the aerosol that you could get this from. And so now suddenly wearing masks seems to make sense.
Yeah, and the CDC is, in fact, Joe, considering, as we speak, making a formal recommendation that people, not just people who've been infected, not just people who feel sick, but anyone who goes outdoors, wear a mask if there's any chance you're going to be in contact with somebody. That's, by the way, something doctors have been telling me privately all the time. If you guys go outside, wear a mask. That's been going on for weeks and weeks and weeks. I wanted to make one other point. You were talking about Governor DeSantis. He said again yesterday that he's just waiting for guidance from the federal government. He's waiting for guidance on the task force. As we talk about Florida, one of the coming hotspots in this pandemic, well, President Trump has a close relationship with Governor DeSantis. If Governor DeSantis really isn't perceptive enough to see where this is headed and what it could do to his state, we should implore the president to make that phone call to Governor DeSantis. If he's in fact waiting by the phone for Donald Trump to tell him what to do, please, Mr. President, call the governor and tell him what to do, because, my gosh, it's coming to Florida and it's coming fast.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.